Aurora Badia. This is my patient Diana today, and I have my assistant Claudine. And we're going to be doing Botox today on the forehead, glabella, which is the area between the eyebrows and around the eyes. Additionally, we're going to be doing Restylane on the nasolabial folds for her, and then also down here. Diana has had this procedure done before, so we're going to be showing you step by step how to do it. And we'll do the Botox first and then the Restylane. The Botox, you won't see the effects immediately. It takes at least a week to see the effects, so she won't see anything today. But the Restylane, you will see right away the effects. So we'll go ahead and get started. Do you have any questions for us, Diane?
No, thank you.
Okay. We're going to have her lean back a little bit, and then we're going to go ahead and do the Botox injections. Okay, we have her frown. We're going to do the glabella area first. So she's going to frown. You can see she's got this dynamic movement of the line, so the goal is to have it to when she frowns, it will look relaxed like that after the Botox has taken effect. Have you turn this way? Okay, go ahead and frown for me, Diana. Okay. And then relax. Okay, so we inject while the patient is relaxed, just tiny little pokes. The risk from this procedure, the most common, is bruising. Sometimes the medicine can migrate to other areas, but generally it doesn't, and it just stays in that area. And we always have the patient come back in 2 weeks and touch them up if they need to. How are you doing? How's the pain level?
Good, thank you.
Diana did have topical anesthetic applied for 20 minutes prior to the procedure, so it takes away a little bit of the edge and the sting of the procedure. Okay, and that's it for the glabella. And for the forehead, we have her frown up with the eyebrows up, and you can see she has these lines across here. And we generally inject all the way across the forehead. We don't inject very low because we don't want her to get a heavy brow like a ptosis, which that's a risk with the procedure if you inject too low or if the medicine migrates. So we're going to go ahead and inject frown up for me again, and then relax. Okay, we inject right in to the muscle. And in women, we inject mainly medially, but we don't inject too much laterally because that gives you like a flat brow and it doesn't let you have that arched effect, which looks more attractive in women if the brow is arched. You can see a little bit of where the injection is, those little bumps, but they go away in about half an hour or so. It doesn't look like she's bruising at all. Minimal bleeding, but nothing to worry. And then if there's a little area that bleeds, we just put a little pressure, and then that usually resolves. Then we're going to move to the other side and then do the Botox there. The other side of the forehead. We're going to have her frown up again. Okay, relax. You can see. Just project right into the muscle. You can see it's a very simple procedure. Well tolerated, a little bit of discomfort, but not too bad. So the last area that we're going to do for her is around the eyes. We also do a little bit here in the lateral brow. We inject a little dot here, and that helps to raise the brow. So we're going to do that now. You can see just a little shot here. Okay. For the eyes are generally the areas that bruise a little bit more. So we're very careful about looking for little fine vessels around the eyes. We're going to have her smile. Okay, relax. Okay, go ahead and inject very closely, but try to avoid the little vessels around the eyes. That's it. We try to inject medially up until the middle where the pupil is, because that gets those little fine crow's feet along the back. So that's that eye, and then we're going to move to the other eye. So we're going to turn this way, so we're going to do that eyebrow, the shot on the side of the eyebrow again to help elevate her brow. Have her smile. Okay, relax.
Your doctor can help you decide whether Botox is right for
you. And that's it. So you can see she's a little bit red, but that'll resolve. There's a little bit of discomfort, but if there's any areas that look like they're bleeding, we put little ice packs, but she looks like she's doing fine. We always have the patient come back 2 weeks later so we can touch them up if we need to. And then we just check and have them move, frown, raise their eyebrows, smile, and then if we need to touch them up, we will. As far as the Restylane is concerned, the areas that we generally do are these lines here, the nasolabial lines. And these areas here, if you look closely on Diana, she has a little bit of a depression here. So we're going to work on those. And also we put a little bit in the lateral lip, and that helps to elevate a little bit of the lip. Because as you get older, you get a little bit of a downturn. She doesn't have it too bad. We're going to have a little bit elevated. It makes her look a little more youthful. So we're going to go ahead and start with the Restylane, and this we'll see the effects right away. You ready, Diana?
Yes.
So this, we don't have her smile or anything. We just go ahead and do a little injection into the area.
That's skincare. If you're like most consumers, it's difficult to distinguish between products that really work versus products that are well marketed. This confusion is why many doctors are now turning to a cross between cosmetics and pharmaceuticals called cosmeceuticals. These products are skincare related.
You can see already the difference between one side and the other. Okay. And here she has this little bit of a depression. We're going to inject right into the depression. Okay. Have you open your mouth a little bit. Then we inject right here onto the side. Okay, have you closed? And you can see that helps curl up her lip a little bit as opposed to this side. You see the lip is a little bit more curled up, and it just gives her a little bit of a happier look. We're going to move to the other side. You can see the effect immediately, the softening of the nasolabial fold. Inject this lower area here. And have her look at me, just see. Okay, you can see it's pretty symmetric, both sides, so I'm going to put a little bit here, have you open. Just a little more open. Close. You can see that helped curl up her lip a little bit. And you can see on both sides it's curled up a little bit. Now we have a little bit of extra medication left. We're going to just fill this lower area in here. See there's a little bit of a depression here and here. Again, as you get a little bit older, it just helps fill in this, just the early signs, not that Diana's old, but you just see the early signs of loss of volume in the lower face, and that helps to make it look a little more youthful. Over the other side a little more, and then that's it. Now the Restylane tends to be a little bit more uncomfortable than the Botox, but generally they're about the same when you say Diana level of discomfort.
I feel the same.
Okay, so then we always have the patient look, so we show them what we've done, okay? Then we ask them if there's any areas that really bother them, or they're still
Look great.
So that's it. Okay.